Hey there and welcome back. So I guess by introduction, I should bring to your attention that addiction counseling in many ways is different to normal counseling. In a normal counseling scenario, usually the client is approaching the counselor with a willingness to deal with their problem. They've come of their own volition and they are prepared to discuss their problems honestly and openly. And as they establish a relationship with the counselor, will more and more begin to discuss themselves without reserve. Now, in the case of addiction counseling, more often than not, the client is coming being pressured by family or an employer. They're not really wanting to be there. To a large degree, they are still in denial about their problem, will minimize what is going on for them in their lives and the problems that they're experiencing. They will justify, they will rationalize, and they will also not discuss themselves completely honestly and without reserve. Now, this can make treating addiction quite difficult because a lot of what addiction counseling is about is confronting the addict's denial and helping them to reach some point of seeing the problem for what it is, accepting that problem, and then being able to apply a solution to that problem. So, a good addiction counselor would be well-rounded and able to shift between various skills when necessary, because the two most important things in counseling really is education and intuition. Education is the easy part. We can do courses, we can read books, we can attend seminars, and we can learn loads of interesting information. However, applying that information is what takes years of practical experience in the field, developing that intuition in knowing exactly when and how to use certain skills. Now, some of these skills I'm talking about would be assertiveness, sometimes having to set boundaries, sometimes having to confront, and yet on the opposite end of the spectrum, to be empathetic. A counselor who cannot be empathetic with the client will always fail to establish a decent rapport. Now, the problem in only being able to achieve one of those ends of the spectrum is that if a counselor is too assertive, they will tend to talk at the client rather than to them, and clients will not respond very well to that kind of approach continuously. And yet on the other side of that is if the counselor is too empathetic, you could get sucked into focusing more on the problem really than on the solution, which is also counterproductive. So a good counselor will know when and how to do both. So I guess to wrap that up, counseling is an intervention, and we've got to remember that that's what it is. When you assist a client into making a decision, a life-changing decision, you're intervening and helping them to achieve the desired outcome. So what is the aim of counseling? The aim of counseling is that we want to enable the client to develop their own ability of making wise and realistic decisions. We want to assist them in altering their own behavior to achieve the desired results, and we want to provide them with information so that they can make informed decisions. We are just facilitating the process of the client becoming fully aware of their problems, making a decision to change those problems, and then actioning that change. Okay, so what is addiction counseling? Addiction counseling is an intervention in which you want your client to discuss his or her substance use and the consequences thereof confidentially. Confidentiality is key, as they will not want to discuss their situation without reserve if they think you're going to be giving a report to a family member or employer. Secondly is to explore possible treatment options that would be most appropriate to his or her circumstances. And we look at that screening criteria more in the 12 core functions, but on a simple level, you want to know what they can afford, what type of modality would best suit them, do they have religious beliefs that would make certain modalities inappropriate, do they have special needs, co-occurring disorders that need to be catered for, and so on. Now, why is addiction counseling needed? And that firstly is because we want to encourage and motivate the client to reduce their substance use related risks. We know that addiction comes with a lot of collateral damage. Families are involved, wives, children, employers, jobs, financial security. And by looking at the reality of the damage that's being caused in these areas, we can help motivate the client to want to change that situation. Secondly, is to support clients into exploring care and support. And for most addicts, they think that they are really bad people, especially with the stigma attached to addiction. And so it is our job to ensure them that they are not bad people, they are sick people, that there is help out there. If they have tried certain modalities, they haven't tried them all, and that it is possible for them to get their lives back on track. Lastly, we need to know that addicts who wish to stop using can often benefit more from counseling in combination with a treatment program. Now, usually with an addict, if they've reached the later stages of the progression of their disease, being able to stay clean or clean up on the outside is almost impossible. So then they would need to explore treatment options and maybe do a detox regime before any counseling would be of maximum benefit. Some of the attributes that make up an ideal counselor are that we want to try and be creative, intuitive, imaginative. Sometimes we need to trust our instincts. A counselor is never going to get by on knowledge alone. And as I discussed earlier, this takes time and experience to develop. What happens in the beginning of our counseling careers usually is a counselor in the training phase will try to emulate and almost parrot the styles and techniques usually used by their supervisor or mentor in their work environment. And while this might get us through generally some of the simpler day-to-day problems and issues faced in treating addicts, it's not going to help us when we're faced with a crisis scenario or when a client throws something at you completely out of left field and you're left not really knowing what to do. But don't be hard on yourselves. There's no counselor just started out as a great counselor. It takes experience and sometimes making some mistakes to learn and develop that intuition. We also need to be practical. If your client doesn't have the kind of experience and knowledge that you have, so remember to always keep it simple, keep it concise. Try and use layman's terms as much as possible, especially in the beginning. And we want to be action orientated. Remember that counseling, we're trying to find solutions to problems and actioning those solutions. We don't want to dwell too much on the problems, and we want to consistently move forward, never backwards. We also need to have a respect for our clients, and this can sometimes be difficult when you find yourself almost getting into a heated argument, or when the counselor really feels they know what the client needs to do and become too emotionally involved in the conversation. And we need to be very careful here, because once you disrespect your client, you've lost the relationship, you've lost your credibility, and you've tarnished the reputation of you, the counselor, and the organization or facility that you work for. And then lastly, we need to try not to impose our views or opinions or concerns on the client. We all have opinions, we all have our own points of view. And what's good for me is not always good for somebody else, and we need to always bear that in mind. Some of the things we want to avoid in addiction counseling. The first is moralizing. You need to be careful not to come from a moral high ground. Your client is there to share about their problems, and it's not our job to moralize that experience. The second is ordering. We are not their employer or supervisor. We can give some advice or suggestion, but we never tell a client what to do. The third is threatening. We need to be aware of our attitudes, our language, ensure that we don't allow the client to feel threatened as we're trying to create a safe and supportive environment where they can share about their problems and feelings. The fourth is arguing. A client might not always heed your advice. They might sometimes even say something that might hurt your feelings. We need to always try and remain calm. Remember that they have a right to their opinions and their decisions, and that we can respect those opinions and decisions. The fifth is disagreeing. Our task is not to decide what is wrong or right. This can lead to disagreement between you and the client, and that can also stall the counseling process. The sixth is over-interpreting. We have to be careful that we don't over-interpret what the client is telling us. This can especially happen with inexperienced counselors who want to come across as quite insightful or clever. This can lead to a lot of confusion and misunderstanding and can also jeopardize the counseling process. The seventh is sympathizing. We'll discuss this a little later on, the difference between sympathy and empathy. But we need to be aware that we never get emotionally involved in our counseling session. And the eighth and last is judging. And this can sometimes be tricky, considering that we are trying to analyze and look at some of the client's behavior and attitudes and perceptions. And oftentimes what will make the difference in them feeling analyzed or judged can simply be in the tone or the manner that you deliver the information to them. So try and always be aware of coming across very neutral. A simple way of looking at the difference between sympathy and empathy is that when you sympathize with a client, you are becoming emotionally involved in the conversation. Whereas when you empathize with a client, you are understanding, yet emotionally unaffected. We need to remember as counselors that as soon as we become emotionally affected by the counseling session, whether we're upset by something that they're saying or disturbed or angered by something that they're saying, our feedback is not going to be 100% objective as it's being slanted by the emotion. So when we empathize with a client, we're merely trying to place ourselves in their shoes to see the experience that they're going through from his or her perspective so that we can summarize and provide objective feedback. We're not obligated to agree with what they're saying. We're merely trying to help them reach their own decisions. We don't carry the burden of the experience with them. Now, when we sympathize, we do carry the burden of the experience with them, and we will tend to agree with the clients. And the client might as well not be sitting with a counselor, but rather sitting and talking to a friend or a mirror of themselves. So just some general principles to ensure quality of service in addiction counseling. The first is that it needs to be voluntary. As we've discussed earlier on, what we do as counselors is we help the client to explore their problems, to explore solutions to those problems and different options. But the client always needs to feel empowered by reaching that decision and making it for themselves. We never force a client to do anything. This can be a very dangerous thing, as if we push or force a client into making a decision, if the situation doesn't turn out favorably, we can then be held responsible or even liable for those decisions. Okay, the next of these principles is confidentiality. And I can tell you that in all the courses I've done, all the training that I've done, what is held in the highest regard is always a counselor's legal and ethical responsibility to the client. And of all of those principles, confidentiality is the most important. We always need to keep the client's information confidential. That includes intake forms, any kind of records, documentation, reports, and we can only share that with anybody with the client's consent. Sometimes, if professionally appropriate for guidance or consultation, we need to share any information. We would then need to have the client's consent, and it's always safest to have that consent in writing. And then lastly, it's also important because if you break confidentiality with the client, you will destroy their trust in you, which would break down the relationship between you and them. Next of these is we need to be reliable, as a client should almost find us predictable in how we're going to be from one session to the next, consistently in our manner and our approach and our moods, that kind of thing, to create a safe and comfortable environment for the clients. The counselor should always express a sincere empathy, as we discussed earlier on, as you want your client to feel like they are being listened to, they are being cared for. We should always provide accurate information and very clear explanations, and demonstrate confidentiality, as we just discussed. Some examples of an unreliable counselor would be one who is late for sessions, impunctual, or promises to provide some feedback or a report and then fails to do so, or is inconsistent in their manner from one session to the next, or their moods, which would create a very uncomfortable environment for the client. We need to always remain non-judgmental, and by that we mean we stay neutral. We don't react to the client's issues. We especially don't judge or react strongly to the client's issues. We need to stay in control of the discussion, and it also helps the client to remain open to change. We never counsel until we've learned from the client's experiences, and this we do by a lot of discussion, asking open-ended questions, accumulating as much knowledge and information as we can about the client so that we can use that information to guide our discussions. One of the mistakes I see counselors make, especially if they've been counseling for quite some time, is they will assume that because they know a lot about addiction and they know addictive type behavior, that they automatically know the client, and they'll base a lot on assumption. Now, this is a huge mistake, as different clients come from different walks of life, they've had different experiences, and their experience helped them shape their perception of norms. Now, understanding the client's perception of norms is vitally important, as it helps us to relate their beliefs to a wider range of options that we want to help them consider. Something else that plays a vital role in the counselor-client relationship is respect. And respect is simple, really. We treat all our clients the same as we would like them to treat us, as mutual respect is essential for effective communication and exchange. So to treat a client with respect means that we treat them all the same, and that is regardless of age, race, gender, cultural background, religious beliefs, financial situation, and so on. A good counselor will always be consistent in the way that they deal with everyone. Safety can be important to both the client and the counselor, and can be on two levels: physical safety and emotional safety. In physical safety, we want to ensure the safety of a physical being, so being aware of threats or intimidation or suicide threats and so on. Your physical environment, or even property, site property. And then on an emotional level, we want to create an environment where a client can share openly about very sensitive topics. And in relation to addiction, those topics can include anything from criminal activity to physical or sexual abuse and so on. And it's important there again to mention confidentiality, where you always reassure your client that whatever is discussed between you is not going to be shared with anyone else without their consent. But it's also important there to say that one way in which we can breach confidentiality is if there's a threat or a danger to the client, counselor, or another human being. If, for example, the client is telling you that they want to commit suicide, or if they're telling you that they are wanting to harm somebody, you then have a duty to warn, in which you can breach or break confidentiality. Last of these is we need to stay linked with other services. And by that we mean that we need to have a good network of other services and professionals that we can link our client to provide them with all the external needs they have outside of just their alcohol and drug use problems. So examples of that would be medical assistance for any health problems that they have, maybe employment referral, vocational guidance to help them find the right kind of career path or jobs, maybe legal assistance if they have pending court cases, or maybe custody battles, and so on.